Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you this week with the Common Sense MD. Today we're going to talk about something kind of dear to my heart and I'm very passionate about. It has to do with what you need to know in the coming year. You know, it's almost Christmas. We have a new year, 2023. What you need to know about the business of medicine and, in particular, insurance, which everybody needs. First of all, I'll talk to you about doctors, since I've been a doctor for 36 years and Dad was a doctor and a lot of my relatives are doctors. So I've been around it all my life. Number one thing I'll tell you, it's a myth that doctors are wealthy. If they're willing to work hard, they can certainly make a good living being a physician. But in general, they're not among the wealthy people in the country, so that's kind of a myth. The only people I would term wealthy in the healthcare industry really would be the executive types, like hospital administrators, insurance executives, pharmaceutical executives, that sort. I've always said that I think doctors really ought to be running the show, like hospital administrators should be physicians, in my opinion, and they should still be practicing medicine, because I think that's how you relate to the way medicine's practiced, if you're actually in there doing it, at least some of the time if you're an administrator. So, and there are those out there that do that, and I admire them very much for it. But most every other healthcare worker is either working directly or indirectly for these executives. So they're really the ones making the decisions. I've been around a lot of hospitals and administrators and doctors, and in general, hospital administrators don't like doctors these days, and doctors don't like hospital administrators. Any doctor will tell you that. Except maybe if they're both and they're trying to bridge the gap, which is good. But in general, I would say that's pretty true. So what about the cost of medicine? That's really what I want to talk to you about today, because, when you get a bill from a doctor or a hospital or anything in the healthcare system, the doctor's really only getting a relatively small percentage of that. Remember, their overhead's high as well. But doctors are really concerned about three things in general. I've said this many times, you've probably heard me say it, but the three things that doctors worry about most or think about most, or they should be: number one, taking care of the patients. That should be the goal of every doctor when they get into medicine, every healthcare provider. Two, they're worried about making a living doing it, making money. They have to support their family. So that's a concern. They have to look at that. It's a job. Three, they're concerned with avoiding a lawsuit. And, that's very important, because if you practice defensive medicine, it drives the cost of medicine up a lot, and it doesn't make for good practice of medicine, in my opinion. Most doctors will tell you that insurance regulations make their practice of medicine unenjoyable. It really hinders the way they have to practice medicine. Through the EMRs, electronic medical records, fear of malpractice, staff shortages, constant worry about being responsible for the lives of your patients. That's a heavy burden on doctors and healthcare workers. So it's a hard job, for one thing. Plus, doctors, they're not really respected like they used to be at all. And it kind of takes a toll on doctors and healthcare providers in general. So it's no wonder that there's a shortage of doctors and nurses, which to me are the backbone of healthcare. And it's no wonder that they're getting out in record numbers now, out of medicine, and they have increased rates of depression and suicide. Plus, look at your average doctor or nurse. They're pretty unhealthy looking, and they're definitely unhealthy. Um, so it's really tough. The reason I run my own independent private practice, private because it's private between me and the patient, um, with no insurance. I don't take insurance for office visits. I don't have an EMR. I have old-timey paper charts, which I love. Nobody can get in and hack them, and it's just between me and you. And I don't like bosses that are non-medical telling me what to do, how many scans I need to run, or I need to see 50 patients a day to make the organization work right. So I'm very lucky to be able to do the type of practice that I do. And you'd kind of be wise to listen to a doctor like me who's 68 years old next month. Your old family doc, and also have a master's in business administration, which I got. So I run my own business, so I really know a lot about the medical business. And you can always talk to me about it if you want. I talk about it a lot because it really makes a difference. But you have to use common sense, and a practice has to be patient-oriented. That the main thing is the patients are the ones that need to be listened to. So I'm going to give you some tips about how to spend your healthcare dollars and stay healthy so you don't end up unhealthy in the hospital. Hopefully not these days. You don't want to end up in the hospital. Or patients may become bankrupt or at least bitter about the health care they're receiving, because it's in a bad place right now. For the healthcare part of it, which will be, I'm not going to talk a lot about that. You listen to my other podcast and follow me. You can learn what I think about preventive medicine, because it's all, to me, about prevention and finding the cause of your problem, not just prescribing another pill or trying to find a code for an insurance company. So what keeps you healthy? Mainly nutrition, exercise, sleep, stress reduction. Stress brings at least half of all medical visits in there, probably way more than that. And screening tests. And avoiding obesity. Our nation's worst healthcare problem is obesity. I've said it many times, if the average weight of the United States citizen was what it was in the 1960s, there would be no healthcare problem, no healthcare dollar problems. And the other tip is, find a doctor who will actually listen to you and treat you like you're the one that's the most important one in the room, not them. They need to learn to listen to you. So now for the business aspect of this thing. You need insurance. Insurance is for disaster, though. It's not for routine care, for everyday thing. If you have a serious chronic illness, then you may need a different kind of insurance. For most people, they need disaster insurance. And what that means is a high deductible plan, which is virtually rampant. That's the way it is now anyway. It's morphed into that. Back when there was no insurance, like when my dad practiced medicine when he first started, healthcare was really inexpensive. It really was. I mean, I think the cost of an appendectomy in 1960 was something like $100, what my dad told me. That was for everything: surgeon's fee, hospital fee, everything. These days, there's so many middlemen in there. Everybody wants a piece of the pie. They want part of your money. So how do you navigate this insurance mess? Because you have to have it. And what are your best options? And like I said, today most insurance plans have a very high deductible to meet before they pay anything. The biggest employer in my region has a $6,000 deductible for the family. You may think when you go to the doctor, all you're going to have to pay is your copay. But then a few months later, you get this bill down the road you didn't know you were going to have to pay for. So there's not a lot of transparency with this, with most insurance companies. The patient, doctor, and staff usually have no clue what you're going to end up paying for that visit or that hospitalization. They don't know. So you can have some surprises down the line. Same thing for drugs, pharmaceuticals. So many different insurance companies, and what they pay is so vastly different. What I found out is that, you're probably better off for a generic drug, which are 80% of all drugs sold, to pay cash for them. They actually way less. So check out GoodRx or Amazon, or maybe even Mark Cuban, that billionaire Dallas Mavericks owner, who has a new company that it's called costplusdrugs.com. And he has a good idea. Drugs are way too expensive. Unfortunately, it's only generics he's dealing with so far. Keep tuned on that one. But the markup on these drugs are unbelievable. I'll give you a good example. I had a patient come in to see me with narcolepsy recently, and I prescribed Modafinil, which is a generic drug. He went to CVS and couldn't afford it. He called my office back that afternoon and said, I can't pay $850 a month for this stuff, which he needed. So we got busy and looked up on GoodRx and found that instead of his $850, it costs $35 a month at Food City. So shop around for your medicines. Very important. I mean, you could be getting ripped off and you just don't know it. So shop around. And for insurance, always, with a few exceptions, maybe for chronic illnesses and severe illnesses where you may have to have really high dollar medications, get a high deductible insurance plan with a health savings account. Those things are just incredible. And this year they're going to be better in 2023. They've upped the ante on them, the limit on them, so it's good. But you can really save a lot of money. And because these things, there's two types. One's called a flexible spending account. And that may be offered by your employer, and they may pay for some of it. But in general, it's kind of a way that you can use your pre-tax dollars to put money in this account that you can spend for the doctor. The problem with flexible spending accounts is that you can't invest as much in them, and at the end of the year, they're up. So you either spend them or you don't. And they're really controlled by your employer. A much better option, if it's available to you, is a health savings account. And these accounts really save workers a lot of money because you can sock away a lot of pre-tax money to pay for virtually any medical expense. Basically, you save what you would have paid for in taxes on the money that you put in these accounts. And most plans now allow you to roll them over. Most HSAs, you can roll them over in perpetuity. I mean, you can keep these things going and building up. If you don't spend it, you can use it like kind of like a 401k, without having to pay taxes on them. So ask about this if it's available. And in 2023, employees can actually put away much more. And even in an FSA, you can put around $3,050 in it, which is up 7% from last year. And single workers who want an HSA they can save up to $3,850, and families can save $7,750 in these HSAs every year. That's an increase of 6 to 7%. So it's really a good deal. But remember, FSAs are different than HSAs. HSA is much better. FSAs are controlled by your employer, and the HSAs are controlled by you. And that's who I think ought to control it. And again, the drawback on the FSAs are that you use it or lose it. So if you don't use all the money, you're going to end up forfeiting that money you've put away. They estimate that over $3 billion is lost to these accounts every year because they didn't use them. So think about that. And also with the FSA, if you leave your job, boom, there it goes. You've lost it. Once you open up an HSA, it stays with you, kind of like a 401k plan, and it can grow with different plans. You can actually use that as an investment vehicle. So HSAs are designed for high deductible plans, which is what I like the best. And you can change the amount of your contributions at any time with an HSA. FSAs, you can't do that. those fees and contributions are set during the time of enrollment, and I don't think you can change it. So with an SSA, you're pre-tax, it can grow over time in different vehicles, and they stay with you. And you can use them on medical expenses. It's tax-free. So it's really a triple tax savings. You know, if you have that available, you're nuts if you don't use it, in my opinion. You can even pay your co-pays off with it, or you can put it back, and if you have a high deductible and you need to use that, say you get in the hospital, etc., you can use it for that. So that's really a benefit that you need. You can even use it for all kinds of things like vitamins and supplements. But remember, you need to use it through a doctor's office or with the doctor's okay on it. But it even covers dentists, orthodontics, eyeglasses, vitamins if deemed appropriate by your physician. So it's a great deal, especially if you have that high deductible, which is what you need. So the out-of-pocket spending that you can control and get reimbursed through that tax advantage plan. I know everything I do at my office, you can put on an HSA. So think of that, for not only for this year, but for next year. If you have an FSA, you better spend it by the end of this year. But you don't want to spend money unless you need it. But if you can deduct it from your HSA and not pay taxes, get your reading glasses through that, maybe vitamins, and even some of the stuff you do at my office that, may not be mandatory medically, but, that's your option to do it. So FSAs are trickier than HSAs. But there is a store called FSAstore.com. There's also an HSA store that you can go look at to see what's kind of covered. Much more lenient on the HSAs. Even Band-Aids are covered, first aid kits, that type of thing. So for HSAs, they will pay for anything recommended by your doctor. So think about it. Even massage therapy can be covered by that. So that's a really good thing. The downside to an HSA, virtually none, except if you took the money out to use it for something different, like buying a car or mortgage for your house or something. And then if you take it out for that, before age 65, you're going to pay the taxes on that. Plus, you're going to pay 20% penalty fee. Once you're 65 and over, you still owe the taxes, but you won't owe that 20% fee. But hopefully you'll never have to do that. So keep it in there and use it if you need it for, to meet your deductible or any health plan that any kind of copay or any kind of eyeglasses or vitamins. Try to use it for that, office visits, etc. So summing things up, consider cash-based doctors like myself. I've been doing this for 17 years. Couldn't be happier. My patients are much better off. I have much more time to spend with my patient. The costs are all transparent. You're not going to get a bill from me. Like I say, you have more time to spend with the patients because you don't have to run patients through like rat on a treadmill. You're happier with your job. A lot of doctors are starting to do this. Within the last year, I've had 3 specialists contact me for advice on how to do this. A cardiologist, an endocrinologist, and a rheumatologist. So I think all kinds of doctors are going to kind of morph into this plan because they're just sick and tired of having to deal with what they do and have that preoccupy their minds instead of the patients that should come first. Because really the patient is you. You're the customer. The doctor's working for you, so he or she better listen to you. So it's even more affordable. It's better care. It's more affordable in the long run. So get a high deductible plan, get an HSA, and make sure your doctor listens to you. I'm going to hopefully do a series on this stuff, the business of medicine, because I think you need to know it. You need to know your options. With all the money going to these pharmacy benefit managers and all these other middlemen, you really need to bypass them and get somebody that will actually kind of direct your overall health care, which specialists you see, which tests you really need and which that you don't. In my office, I have no incentive to run an unnecessary test. Certainly, I have incentive to take care of you. and tell you where to get the best deals on anywhere you go. So think about the business of medicine. Unfortunately, we have to deal with this, and fortunately, I enjoy dealing with this. I like running my own business, and I like being a private practice doctor. So I hope this helps you a little bit. Any questions, please don't hesitate to call and stay tuned to our podcast. Thank you.